This is Joe Mullings with The Other Side. I've got Scott Whitaker rejoining us again from Washington. Scott was in earlier, about a week and a half ago, taking us through the initiation of the COVID crisis. So, Scott, thanks for joining us again.
Yeah, good to be with you, Joe. Thanks for all you're doing. Your shows have been great. I've watched as many as I can and have really enjoyed it.
Yeah, and I appreciate leadership coming out and sharing their thoughts, and certainly support of what's going on in the industry. And you and your organization have been super busy in Washington as well as around the country. Fill us in on what's happened over the last 2 weeks in particular from your perspective.
Yeah, so it has been, doesn't feel like 2 weeks. It feels like 2 years in many ways. And it's been quite a grind. I think I said to you before when I was on a couple weeks ago, it's great to be a part of an industry like this because we're solution oriented. And that has played out throughout the course of this crisis. We are on the front end of diagnosing people who might have the disease, treating people in a hospital setting who do have the disease, and protecting doctors and nurses and healthcare workers from the disease. And so an industry like ours is not only critical, but essential to winning the battle. And so we've been fighting on all three fronts. There have been times, Joe, where it has felt choppy, but as we've come out the end of each of these, we're in a much better place for it. And so I'm a little optimistic by nature. I'm encouraged, though, by where we are today.
And it's interesting because you, in your role as president and CEO of Advamed, work very closely with small, medium, and large medtech companies, diagnostic companies,
right,
and also closely with the Hill and the FDA. What have you seen that has been extremely unique relative to the agency and the response from our industry?
The public-private partnership and cooperation has exceeded my expectations, and I think it's why we're better off today than some may have thought we would have been 2 weeks ago. And it starts at the top at the FDA with the leadership of Dr. Hahn, who came into that job, as you know, Joe, just 1st of January. The value of having Steve in that job, though, was he was in the hospital industry. He was an oncologist. He's been in the healthcare industry and run large institutions for a long time. He stepped into that role and has excelled in a way that, and I've known Steve for a while. Even I have been surprised with how great his leadership has been. So as you're looking at each of those areas that I mentioned earlier, in each of those categories, the public-private partnership and collaboration has been essential, and it's been very, very good. And it's important. It's a really important lesson to learn that these two entities can cooperate well and get to a good result if we're talking.
Will there be some overhang in a positive way as the FDA reviews what it does moving forward, post-COVID, whatever that looks like? Are there some lessons or some aha moments that may change that trajectory of FDA and the industry?
There may be. I wish I had a good answer for you today. I probably don't. I think when we come to the end of this crisis, whether that's a month or 6 months or a year, I think there's going to be a joint effort by private industry and FDA to look back and see what worked really well and what didn't work quite as well. The one thing that's been on the front burner through this entire process is the emergency use authorization program inside of FDA. And as I look at it today, that's been a shining star. One of the questions I've asked myself, though, Joe, and I don't know the answer to it, I'm not sure anyone does yet, is are there lessons that we've learned about how quickly we can move together that would be instructive outside the context of an emergency? And if we can apply those to other regulatory processes and decisions, it could be very, very good for us. That also cuts the other way, right? As you know, and so that's why we need to learn a little bit more and reflect a little bit more.
Yeah, staying on the FDA and the great job that they're doing there. Obviously, things have been put on pause. My client companies and certainly your customers, the elective surgery part of the industry has been put on hold appropriately, but there's talk about re-entry now. And then there's the really emerging tech startup play where, maybe somebody was in the middle of a process with the FDA or going through CMS for either local or regional or national coverage. How does that redeclare itself? And is there conversations around that right now for those that are burning through time and money?
Yeah, you've hit the exact issue. There are decisions that are pending at FDA. There are decisions that are pending at CMS that could serve as, in many ways, an economic stimulus to companies in our space in order to keep them afloat and allow them to continue to grow and progress. And so, what we have done at Advamed, and you're very timely with your question, is we're going to be communicating to the administration very soon, maybe within 24, 48 hours, on a list of things that they can do across all forms of government agencies, not just FDA and CMS, but we're looking at USTR, we're looking at the SEC, we're looking at other agencies as well that could stimulate economic growth by administrative action. The two you mentioned, FDA and CMS, are really important. One of the things we've been focused on at CMS is if there's a pending application, let's err on the side of approving that quickly. So the company that can then go out and continue to raise the money they need, they can continue to keep their employees employed so they don't have to go off the employment rolls, and continue to make progress on either a breakthrough technology or another technology. So let's not shut down base business. It's easy for me to say that to them. It's harder maybe for them to do. But we're going to outline in the next 24 hours a series of policies and suggestions that we think could hit right at the heart of your question and help stabilize the industry challenges that we're seeing.
And how about the elective side of things? So I've got a number of clients who have the elective, we'll go into the ortho business, right? That's a very heavy elective centric industry.
Yeah.
And that is going to be a needle to thread because you're talking about bringing in reps into surgery centers and or ORs. You're talking about still a very hot zone, and all we need is one or two mishaps there. And does that then shut the trap door again?
Yeah, that's a really important one. We were pleased and we were very engaged with the administration when they started this process of phase 1, phase 2, and phase 3 reopening of the economy with some data and guidelines that are in place. They started with opening elective surgeries in ambulatory surgical centers, which was a good start, and outpatient settings, other outpatient settings. So that was a step in the right direction. But we've got to move more quickly back to inpatient elective surgeries as well. You're starting to see, I think in Louisiana today, an announcement they're going to begin opening up elective surgeries. In other states in the middle of the country, you're seeing more of that. I was talking to a hospital CEO a few weeks ago who said, even during the height of the crisis, we had a lot of open beds and a lot of opportunities for elective surgery, but we were afraid to do that because of what might be coming. And I think that fear is dissipating just a little bit, and I think it's encouraging. And so we're going to continue focusing on elective surgeries and pushing for those to be open as quickly as possible. The sales rep side, maybe just better described as associates of hospitals who help make sure the elective surgeries run correctly and fix the tools and machines that are in the surgical centers. They need to have access to hospitals. I had a conversation with the American Hospital Association CEO yesterday, and we're working on a collaboration directly to that point, Joe, so we can get better guidelines together.
The PPE and ventilator, depending on who you listen to, seems to have been satiated right now. Maybe not ideal, but certainly is flattened out in regards to supply demand, at least on the diagnostic side of COVID. But it seems like we're still having challenges in managing the disease as we think about what appears to be simple things like swabs for test kits, and throughput for test kits. What have you seen or heard right now in Washington and in the industry? Is that something that we're not prepared for, but we're responding to appropriately?
We were not fully prepared for it, but I'll say this, Joe, you're never prepared for a novel virus to hit the country the way it hit us, right? And so to me, the response versus the preparation is so much more important in this case. You can prepare for an antigen or a pathogen, I should say, that is known. Ebola, smallpox, other things that the H1N1, swine flu, where there's elements of predictability in how you manage that. For a novel virus like Corona, COVID-19, really hard to prepare for that. So that being said, I think we've responded really well. You've identified several issues: test kits, tests, supplies like swabs and other things, where we currently believe we have enough in the pipeline, but if we scale up 10 times where we are today, it could potentially become a problem. And that's what we're focused on, trying to stay ahead of the curve as we scale up our testing, which is going to go up dramatically in the next month, And it's all the diagnostic companies that are on the front lines of scaling up those tests.
And that, I think that is an important point, because to date, most of testing is focused on diagnostics of,
right.
Are you sick? Let me confirm you're sick. But if we're going to manage this disease or manage this crisis, it's going to be test, trace, and then isolate moving forward. And I'm really curious on your thoughts on, we just touched on the supplies. We are not properly supplied to test in order to manage. Now the tracing. What are your thoughts on that tracing in order to, once we do catch somebody who's positive, how do we trace them and then isolate them so we can start to stay ahead of that?
There's two components of it, right? There's mandatory tracing, and then there's voluntary cooperation in order to allow for tracing. So you can really only trace people who have been tested or shown signs of the disease. And to some degree, the individual has to allow you to trace them as well. You can only isolate if people are willing to isolate without using the police state to get there. This is not a country that uses a police state to quarantine and isolate. So there's a voluntary aspect of this that is essential. What's encouraging about it is I feel like over the course of the past 4 weeks, with the stay-at-home orders that have gone out, by and large, people have understood and cooperated with that. If we continue that trend, it allows for us to contact trace, to isolate, and then manage the spread of the disease. If people veer from that, then it does become a bigger challenge for us. I'm not sure what the answer is, but the public health agencies at the federal and state level have to work hand in glove to make sure this works. CDC can't do it alone. We can't do it alone. The states can't do it alone. It requires all of us working on all three aspects of that.
There is the capability to trace. Israel uses a very interesting platform. Of course, different country, different mindset. But I think Google released a software platform last week, if I'm not mistaken, that you can download on your phone, and it allows you to opt in for tracing. And so does that become an FDA regulated, in your opinion, an FDA regulated pathway for diagnostic and tracing, based upon, and again, to give a background for our audience, in Israel, on your phone, they have a system they can enact it. And if you test positive, they can go ahead and rewind your phone 2 weeks and see the other anonymized nodes you've come in touch with. And through SMS text, they can reach out and say, you may have been exposed, please get tested. Do we have anything like that on the horizon?
So the technology is on the horizon. I think there are bigger constitutional issues about our ability to do that and control data and get inside people's technology and phone. You reflect back on the challenges Apple had with the federal government in doing it in the context of terrorism, right? Where we even ran into problems accessing that data. So, Joe, the concept is really good. Do we have the technology? From a technology standpoint, I think the answer is yes. The question is, do we have the mechanisms in our system of government to make that work? I would say probably not today. Would we get there if the virus gets worse? People may come to accept it in the event that it does get worse.
Yeah, we've had it with the issue with 9/11, and we gave up some of our freedoms there. And again, how you define freedom, but opting in to potentially head off something like this again, which will happen. You and I know this will happen again on the pass. Look, we can always review the game tapes on the crisis, and I'm with you. This is where we are now, and let's fix it. Let's not point. But as we look at the game tapes here and we think about supply chain, and what does it mean to the rest of the world when we assume, and we might want to, a buy and build America on the supply chain? Because we're finding out very quickly that that's an enormous gap in both security, freedom, and health. Thoughts there?
Yeah. So two things. One, I've reflected often on a quote that Eisenhower is famous for saying in the context of war. Plans are worthless, but planning is essential. And I think that's the case here as well, across the board of the work we're doing. So Joe, I think specific to your point on Buy America, right? You can have the best plans in the world if you would like on making sure we're manufacturing more product in the United States. But when you're hit with something, you can't then rely on what you hope to be the scenario of having everything manufactured in this country to deal with the disease, right? And so we've had that conversation with the administration. To their credit, they have not yet overreacted and tried to move everything back into this country during a crisis. But I think we need to recognize the political reality of this situation today, which is I think everyone would agree probably that it would be better if we had more manufacturing capability here. But everyone who's informed would also know you're not going to do that in 2021, right? You may get there in 2030, and there's a process that you have to go through. And if that is the trend we want to follow, that's fine. But let's recognize the reality of the global supply chain now and deal with the global supply chain as best we can. Policies have to support that. Tariff policies, international trade policies, and public health policy. And that's what we've been arguing so far, rather than thinking about what Buy America looks like 5 years from now.
Yeah. And that's an interesting road to go down. And one part you did leave out, and I'm sure the conversations are happening, but all of our Medtech family who have billions and maybe trillions overseas that they don't repatriate because of tax code, it would be interesting to open up that window to repatriate that money at a very, very low rate, given our scenario over the next 24, 36 months, to provide this country with infrastructure, construction, and jobs that we're going to need because there's a number of jobs that are going to disappear.
Right. No, you're exactly right. We have to be forward thinking about this. And I think one could argue that we haven't been as forward thinking about it as we should have been. And it's something that needs to be addressed as soon as this crisis is passed.
And then finally, Scott, how do you see the balance of 2020? Because I think we're starting to have a little focus of a horizon, but it might be a false one based upon the next couple of weeks and how we slingshot or boomerang back with a relapse potentially if we start too early. But we have to start. How do you see managing 2020 as one of the leaders in the device world of managing the COVID disease? Because we're not going to beat it. We're going to have to manage around it. And then getting Medtech back on the track, at least, running around that track. Thoughts there?
Yeah, so it's another great question, Joe. I think we'll have a better answer for you June 1st, because much of the company is focused on trying to reopen. Much of the country is focused on trying to reopen by that date or in and around that date. And I think by then also, which is a month, 6 weeks away, we'll have a better sense of the trend lines on this disease, and we'll have to understand it better then. I will say I'm pretty convinced that this is going to be with us for 12 or 18 months. And so it may be 100% of your time today. I suspect by September 1st, it's going to be 75 to 50% of your time. By the end of the year, it probably slides down even further. But it's not going away completely. And there are many aspects of it to manage. So I think as an industry, we just need to be prepared to recover and rebuild and be patient as we go through that process. We launched yesterday, and more to come on this in the next 2 days, what I'm describing as the Recovery and Rebuilding Task Force of Advamed, where we're bringing a collection of our CEOs across all aspects of industry together to begin looking at what are the reentry, reopening issues that we're going to face. How can we collectively address those, share best practices, and have some guidelines to help us get there? And we'll launch that by the end of this week, Joe, and then we'll have some recommendations coming out of that task force, which I think are going to be very helpful to the question that you raised.
That's awesome. And then finally, last question. What has been the brightest light that you've seen so far in your role and the position you've sat in through this crisis?
The ingenuity of the medical technology industry to look forward and fix problems that exist today and prepare for additional problems in the future and challenges in the future. That has been, I think, the brightest light. And we've delivered in a big way. A component of that, though, is honestly, Joe, and depending on who you talk to or who you listen to, there are a lot of people to give credit to or to blame. But the public-private partnership between the federal government and this industry has been very, very good by and large. And I think that's something that we should all celebrate, regardless of what party you are, regardless of who you vote for or don't vote for. The fact that the government reaches out to us and asks us to help them solve problems, whether they were prepared or not prepared, we're collectively solving problems. And I think the psyche of the nation would be so much stronger today if we focused on how we're working together to solve the problem rather than blaming people who might not state the issues correctly. And so that's what I've been focused on. It's a bright light to me. I hope others share that view. And Joe, I know you do. It's the way you think as well. And so I'm pleased. There are a lot of challenges ahead. There have been a lot of problems, but I'm pleased with where we are.
Yeah, I think you and I were chatting before we went on air. We never wanted to be here, but right in the middle of the fight is where we love to be.
Yeah, you're right. That's it. Well said.
Yeah. Well, listen, I know you're busy getting back to work for the industry. Again, I appreciate your time. I know you squeezed us in, and I want you to stay safe.
Thanks, Joe. Love being with you. Thanks for all you're doing. Have a great day.
Always. This has been Joe Mullings with The Other Side.